So my name is Crain. I am the district nurse for Idabel Public Schools, and so my position has 4 school sites that are all over town, and I have about 1,200 students, about 200 adults that I'm responsible for in that position. So I knew from a very early age that I wanted to be involved in healthcare, and so all the time that I was growing up, I kind of looked at different positions in healthcare. I looked at possibly being a physician. I worked in medical records in the hospital. I did a lot of different things to kind of get to know healthcare. And then when I was in middle school, my mom went to nursing school, so I got a pretty big taste of what that looked like and what nurses did and how they were trained. And so after I finished my bachelor's degree, I decided that nursing is the route that I wanted to go. So I started out, I got a bachelor's in English and was pre-med, and then decided that I wanted to go to nursing school. So I transferred to a different university, or actually started over at a different university, and got my bachelor's in science and nursing. And then I worked in a variety of nursing jobs for about 15, 17 years, and then went back and got my master's in nursing. So I was very strongly academically prepared for nursing by the time that I started it. I don't think anything really prepares you for the realities of nursing until you do it. So I started out life as a nurse in the neonatal ICU. I stayed there for about 5 years in a high traffic urban area, very big city. And then I moved back to the rural area where I grew up, and that type of nursing wasn't available. So I looked around to a lot of different types of nursing. I worked labor and delivery, I worked long-term care, nursing homes, I worked actually in a law office for several years, did a lot of different things, and came to school nursing because I really liked the pediatric aspect of it. And then after that, became a nursing instructor and worked as a floor nurse during COVID before coming back to school nursing. So typically, since I cover 4 school sites, I have my schedule set up where I'm set to be at a particular site on a given day. So like Monday is the primary school, and then Tuesday is the elementary, so on and so forth through the week. I also I stay on call for all 4 sites all the time. And so like this morning, today is a high school day. I started out at the high school. Taught a lesson for some students this morning, and then went to the primary school and handled all their minor emergencies that they'd accumulated so far, and then came back to the high school to finish this. And there are days when I'm at all 4 sites before 9 o'clock of a morning. There are days where I'm at one site all day long. So it just kind of, it really is dependent on the day, how it looks. A lot of times there are different needs at each site. So the smaller children tend to be a lot more physical needs. They bump their heads, they skin their knees, they have allergies or lice or stomach bugs or that kind of thing. And then the older students tend to have more sometimes mental and emotional needs. And so it can sometimes be different kinds of nursing all at once on a given day. They crawl on things, they climb on things, they hang upside down, and they tend to break things. And high school kids break things too, but they tend to not have as many visible wounds. So probably the biggest challenge with this position is literally there are 1,200 of them and one of me. So I have 1,200 students that deserve to have quality healthcare oversight. So they deserve to have someone checking on their immunization, someone checking on making sure that they have the health information that they need. And I'm spread thin all the time because there are 4 sites and there's a lot of things going on. And so sometimes I feel like the squeakiest wheel gets the grease, and there are a lot of things that can very easily get missed. So that's probably the biggest challenge here. Biggest challenge in nursing overall is wanting to help in times when we can't. We can't always fix the problem. And so that becomes, interestingly enough, sometimes harder to explain to families than it is to the patients. So dealing with family members that are disappointed or hurt or worried about their loved one, when we can't solve the problem is one of the toughest. So I really kind of get to be an ambassador for nursing because, especially as a school nurse, a lot of the interactions that I have with students end positively. So they get to like coming to the nurse. They get to learn to trust nursing as a profession. And so I can kind of build a little bit of that trust and rapport to break ground for healthcare needs that they'll have further on in their life. And so, if I can teach them that it's okay to come talk to a nurse, it's okay to come talk to somebody, it's okay to ask questions, even if you don't think it's a big question or you don't think it's a big problem, it's okay to ask things. Hopefully that can build that trust for them to be able to ask the questions they really do need to ask at later in life, or now if they have something major going on. So my advice to someone who thinks that they want to be involved in healthcare at all whatsoever in any realm is to go and shadow someone. Go find someone who does that job and spend a day with them and see if you like what they do. And so, if you have someone that thinks they might want to be a nurse, I would suggest they make contact with a couple of nurses in a couple of different realms and see different types, because my day looks very different than an ICU nurse, looks very different from a labor and delivery or hospice nurse. So there's so much in nursing, there's so many options. And then the next thing is, I would say to seek out the best training that you can find. So I was fortunate in that I went to nursing school in a major metropolitan city. All of our clinicals were in major urban teaching hospitals. And so we got to see everything. We got to see lots of things. I also taught nursing in a very rural, very small area. And the clinical experiences that we could offer those students were just not as in depth, because we had a much smaller patient population. We had much smaller hospitals that did less acute things. So my suggestion would be to train in the most challenging area that you can find, even if that means finishing your nursing in a rural area and then going to work in a city for a while. But get yourself as much exposure to as many things as you can, because you don't ever know as a nurse what's going to walk in your door. So that depends on a lot of factors. If finances are not involved at all whatsoever, and you are a person who is academically oriented, I would look for a traditional BSN or Bachelor's of Science in Nursing program. If finances are a choice, or you want to start in a smaller pond, so to speak, I would look at an associate's degree nursing program in a community college and get your, it's called an ADN or associate's degree RN license first, and then there are transition possibilities to finish your BSN. So it really kind of depends on the person and their own or their family's needs. Some people are bound to a place, like if they have kids or if they have, parents that are ill, or they, their spouse has a job, something like that. So I would say look in your area and see what's available. There's also a trade school type option, the Kaimashi Training Center in our area of the country, but there are also other what used to be called vocational training schools or VOTEC areas. They also have a practical nursing and licensed practical nurse, which is kind of a first step in the door. So, and that's a 1-year program. Associate's degree is 2 years, bachelor's degree is 4. So it also depends on how much time that you have available too. To healthcare. So in Oklahoma, we have something called Physicians Manpower Training Corps, and that will apply to a lot of different healthcare type fields. And it is a situation where they give you a scholarship while you're in school, and then you agree to work in Oklahoma for a period of time after. So that's available. A lot of the tribal health systems have scholarships available. So if you are a member of any of the Native American tribes in the state of Oklahoma, several of those have scholarships. And then if you're looking at a traditional, like a BSN program, traditional bachelor's program, then, you know, any of the academic scholarships are also available there. And then as you move forward, there are also sometimes, it's called Nursing Education Loan Repayment Program, where you may have student loans while you're in school, and then after you're out, you can work in like a payback type situation, and for so many years of working, they'll pay off a certain amount of your loans. Some of the hospitals are also looking into that kind of situation, and some of the hospitals also will offer sign-on bonuses, which is almost can be a scholarship after the fact, in that you can take that sign-on bonus and pay back any student debt that you might have. I would say that if nursing is something that you want to do and it's something that you have a heart to do, to pursue that and to keep looking and keep searching around, because there's a lot of different types of schools for a lot of different types of nurses. And there's a place that you can find to do that somewhere.